I'm Gigi Schweikert, and today we're at the JFK Medical Center in Edison, New Jersey. And we're going to learn a lot of things about their stroke treatment center that you're probably not aware of. I'm here with neurologist Doctor Panrzia. Tell me a little bit about your title, what you do here.
Hello. I am a stroke neurologist at JFK Medical Center. I'm the medical director of the Comprehensive Stroke Program.
That's wonderful. Now, how long have you been doing this?
I've been doing this for over 8 years.
Wow. So what are some of the symptoms that you might anticipate for someone who is having a stroke?
Well, basically a stroke is, what a stroke is that there's a sudden disruption of blood flow to specific parts of the brain. So a blood vessel is blocked off, and depending on which area of the brain is not receiving blood flow, patients will have symptoms that, according to that area of the brain that's dysfunctional. So they may have symptoms including things like weakness on one side of the body, numbness on one side of the body, severe headache, trouble with their vision, dizziness, difficulty walking. It could be a number of neurological symptoms.
So let me kind of say it back. So basically a stroke is when blood is not flowing. Is that right?
Absolutely.
Okay. And some of the symptoms then would be a weakness or a pain or losing breath, you said?
Well, so weakness, losing sensation, difficulty walking, dizziness, difficulty seeing, all of these could be some symptoms of stroke.
So at what point would someone who's experiencing some of these things reach out to a medical professional?
The best time would be immediately. You know, we say in the stroke world, time is brain. So the quicker you recognize the symptoms and the quicker you call 911 and come to the hospital, the quicker we can do something to try to intervene and help people.
I'm the kind of person, as a mommy of 4, and who's a little bit embarrassed sometimes if I don't feel well. So I think there are a lot of people out there who might be like me, who kind of say, oh, I'm going to feel better, I'm going to be okay. What if we were actually to call 911 and it wasn't a stroke? How does the hospital feel about that?
That's okay. We err on the side of being cautious and evaluating every patient and taking every patient seriously. So any person who has a sudden neurological symptom should take it seriously and shouldn't hope that time will take care of it. JFK was certified as a comprehensive stroke center back in October 2012, and we were the first in the tri-state area and the 8th in the nation to receive this honor. So it's a big deal.
So this was in 2012, and you talk about the tri-state area, which means New York, New Jersey, Connecticut, and I think sometimes we're always thinking that, I know I live in New Jersey, that maybe the best is across the way, right, through the tunnel, over the bridge to Manhattan, and what you're telling me is that it's not necessarily true.
Right. You don't need to run over there to get your stroke care. We have it all here.
And that's great, and also 8th in the nation. So that's really very impressive. So as you're thinking about that, the people in your lives who could be at risk for stroke, or yourself, and looking at those symptoms, first thing to do, make sure that you call 911, even if it's not a stroke. Better safe than sorry, and know that the JFK Medical Center, the stroke program here, is one of the first ones accredited in the tri-state area and only one of 8 in the entire nation. That's good care.